Hello and welcome to IMHIP's Executive Corner. This is Samantha Olds Frey, the CEO of IMHIP, also known as the Illinois Association of Medicaid Health Plans, representing the entire industry of Medicaid health plans serving the Illinois Medicaid program. Today, we're going to talk about maternal health and what we have done holistically to improve birth outcomes for those who are supported by the Medicaid program, but truly all women in Illinois. And the reason why we talk about all women in Illinois, even though by and large we talk about the Medicaid coverage and the Medicaid program, is that Illinois supports 50% of births that occur every year. So 1 out of 2 babies is born supported by and relying on the Medicaid program. And so what that means is, as the largest payer for births across the state, is that the Medicaid program has a unique influence over public policy and over the outcomes of women who aren't on the Medicaid program. And so the initiatives and the undertaking of this program and of the Medicaid health plans has a larger ripple effect through our entire community. What we have found through the Illinois Department of Public Health's maternal morbidity and mortality report is twofold. First, it's that we still see racial and ethnic disparities, and that Black women continue to die disproportionately at higher rates due to medical causes because they are not taken seriously in terms of the experiences that they're having leading up to their birth and then after labor and delivery. What we also see is that white women are more likely to die from pregnancy-related maternal health conditions. And so what does that mean, and what can we do holistically to improve the birth outcomes and then the care after labor and delivery for women across the state? And first, to sort of understand why we're diving into this sort of a two-prong approach, it's important to remember that 34% of women who died while pregnant or within 1 year of pregnancy died from a cause related to pregnancy specifically. But what that also means is that the majority of women died because of something not specifically related to their pregnancy. So not something like preeclampsia or complications due to delivery, but really something else. One key piece, the leading cause of pregnancy-related death was mental health conditions and substance use disorder that has been left untreated, which comprised roughly 40% of pregnancy-related deaths. And so what this indicates is that we need to not only look at the prenatal period in terms of how do we improve coverage, and then labor and delivery, how do we improve that experience for all women, but also the postpartum period. And what are we doing to support women around postpartum depression, postpartum anxiety, but also making sure that there are avenues for substance use disorder treatment for these women to get the care that they need. And so what are the initiatives that we've undertaken here in Illinois? The first is implicit bias training. And this was championed actually by the Medicaid Health Plan Association, by IMHIP, because what we did when we looked into outcomes for pregnant women and medical interventions with our CMOs, we found over and over again that strictly clinical interventions still had the disproportionate gap and the disparities that existed between Black women and white women. And so that without tackling implicit bias within our healthcare system, you are not going to close that gap. So we found in House Bill 158, the Black Caucus pillar does require implicit bias training for healthcare professionals that are interacting with pregnant women. But further than that, all physicians and PAs and nurses, because what we know is that the care that a pregnant woman receives is just one piece of that family, and that the dad and the grandmother and other siblings matter as much to that pregnant woman and to the health of that newborn as the mom themselves. We've also expanded doula services, which we've seen help tackle the healthcare disparities between white and Black pregnant women. We've extended Medicaid coverage for a full year after delivery. And the goal of that is to make sure that that mom is supported with healthcare coverage in the most vulnerable year of her life. And so this is going to provide comprehensive coverage for physical medical care needs, such as follow-up appointments with your OBGYN or your PCP, but also mental health and substance use disorder treatment, so that if you do find yourself in the postpartum period experiencing postpartum anxiety, postpartum depression, or you need substance use disorder treatment, you have coverage and you have support to get those treatments that you need to support not only yourself, but to support your entire family. We've also seen an expansion of telehealth to meet women and families where they are. We have health plan initiatives such as support groups, baby showers, food support, laundry services to address social determinants of health. And then, and critically, we have transportation services. And this is particularly important given that we still are in a pandemic and that all of the healthcare appointments that pregnant women do go to. And so what is important to note is that the Medicaid health plans cover transportation to and from doctor's appointments, and often additionally to the pharmacy should pharmaceuticals be needed. And so this is critical in making sure that our pregnant women get to the appointments that they need, because we know that prenatal care, the comprehensive prenatal care, improves birth outcomes. And so wanting to remove various social determinants of health barriers away to ensure that we get the outcomes that we need and that our members absolutely deserve. And so these are the things that the Illinois Association of Medicaid Health Plans are doing, that the state is doing, and that we're partnering with our community partners to improve birth outcomes across the state. If you're interested in learning more about maternal health, please do listen to our Sam Says series this month, where we'll be covering maternal health. We'll also be having a webinar on maternal health this month. Really excited to continue this discussion, as it's so critical for our entire community. As always, follow and like us on social media, Facebook, LinkedIn, and Twitter, and have a good day. Stay well.